Hi, everybody, and welcome to Human Resource Executives Ask HRE Live Q&A. Today, our topic is improving diabetes health outcomes in the era of remote care. I'm Kathryn Mayer, the Senior Benefits Editor at HRE and Chair of the Health and Benefits Leadership Conference. And I'm joined today by Molly Wagman, who is a registered dietitian, nutritionist, and certified diabetes care and education specialist. She leads the My Sugar coaching team and clinical programs. Molly has experience working with people of all types of diabetes achieve their health goals, and she's very passionate about finding ways to simplify diabetes management. She has lived with type 1 diabetes since she was 9 years old. Hey, Molly, how are you?
Hi, good. Thanks for having us.
And we're also here with Scott Johnson, who is an experienced patient advocate who has worked with a wide range of stakeholders across the healthcare environment to help them establish effective communication with the patient community. His expertise in the diabetes social media space is recognized worldwide. And today he is the patient success manager for Roche Diabetes and My Sugar, and continues to also run a blog, scottsdiabetes.com, as time allows. Welcome, Scott.
Hi, Kathryn. Thanks for having us.
Yeah, thank you guys so much. And we are going to dig into a couple of very big topics for employers today. One, which is remote care, which has exploded in growth, especially during this last year with COVID-19. And then diabetes management, diabetes being, a very important health condition for employers to look at, considering it afflicts so many employees today and has a very big healthcare impact and a big cost impact for them as well. So I'm really looking forward to this. And just a note to people listening in, you can ask questions in the comment section. So feel free to do that and we'll get to those questions as time allows. So without further ado, let's get started with some questions and discussions. So it goes without saying that COVID-19 has accelerated the use of telemedicine. But outside of the pandemic, why else has remote care and telemedicine increased in popularity?
Yeah, the value of remote patient monitoring has been studied for many years, and the COVID-19 pandemic and all the lockdowns we've experienced over the last year really put it more front and center. Remote care is among the most efficient and effective tools available for the management of chronic diseases like diabetes, particularly for older adults. Remote care is here to stay, and here's why we think that's so. Telehealth can improve affordable access to quality care by removing some of the traditional barriers that exist, such as travel, mobility, and time constraints. And remote care has also been shown to be as effective as in-person visits for certain conditions. Molly, what else would you add to that?
Right, and that's why both physicians and people living with diabetes and other chronic conditions have really adopted this remote platform in lieu of the in-person visits. And this can be from many reasons, from necessity to like the pandemic, but also conveniences, but not just convenience that it's a lot easier, but really overcoming some of these bigger barriers like Scott mentioned. And this is going to shift how medicine is conducted permanently. People with diabetes will increasingly seek out some of these remote means for obtaining care. And I think it will become much more normalized over the future.
I bet. As someone who's, in the last year during COVID, I've definitely done more of these telehealth appointments, which I hadn't really done in the past. And I can't believe how much time it saved me just on the commute alone, especially when you're, and it's during the day and you're like, I'll be gone for several hours because I have to drive there and come back. So I feel like, especially with employers, there seems to be a big convenience factor for that as well.
It really streamlines the whole experience, doesn't it? You take time off work, you have to travel back and forth from the appointment, you check in at the appointment desk, you pay your copay, you sit and wait in the waiting room, then you get called back to the doctor's exam room and you sit and wait in there. And then you have your appointment, which is great. And then you do many of those steps in reverse before you can get back to what you were doing before your appointment. So, you mentioned the time savings factor. That's a really big part of it. Absolutely.
Yeah, absolutely. And, next question is, why is it more important now than ever to provide remote care options to an employee population? Because that's, of course, the other big part of it is if we want employees to partake in it, you also have to provide those options to them.
Yes, well, first, we totally agree that remote healthcare options for employees, and especially with employees with diabetes, is really important. And people with diabetes they have one of the conditions where regular follow-ups are necessary. And we think that individualization is key too. So in these remote healthcare options, everyone's needs are a little bit different around coaching and that the care that they get. They may have preferences for different times of the day, especially when employees are working shift work, where they're going to have non-traditional schedules. They may have different types of self-care that they do. So the remote care just increases the flexibility. And Coaching for My Sugar, for example, offers personalized coaching one-to-one, and patients can access it at any time. And then the remote care also eliminates risk for exposure to infection of any kind compared to an in-office visit. And the pandemic really underscored how important that benefit is. It probably saved lots and lots of lives, because if you can imagine going into the office and a majority of people are sick, that infection can spread.
Yeah, that was a big point for me, where I felt through remote care and remote monitoring, I was able to continue my care with my providers, whereas I would not have been comfortable going into doctor's offices, especially as someone living with diabetes. I was doing everything I can and everything I could to really limit my exposure there. So it was coming critically into play in removing barriers and obstacles to care. It also offered some of those economic benefits that are very important to some people, right? So just as we talked about, Kathryn, where it's often necessary to take multiple hours away from work, and some employees just simply aren't paid for that time, or they have to burn up vacation time to get to their appointments. And that's kind of a bummer when you're an employee thinking about, I want to save my vacation time for time with my family, or if I have to take unpaid time, that just is frustrating. And really, employees appreciate when employers support their healthcare needs. And this shows in many ways in productivity, in morale, and lower turnover. So we actually did a survey of employees with diabetes that we sponsored last year. 81% say that with a personalized company-sponsored program, they would be less likely to hide their disease, and 93% say that company support that recognizes their individual needs would make them feel like their employer understands their diabetes and values them more. So when employers provide employees with access to remote diabetes care, it's a really clear signal that they value employees' health, time, and safety. So Roche Diabetes Health Connection is designed to personalize and simplify that diabetes management, both at work and at home, for employees living with diabetes.
Great, absolutely. I think, like you just said, especially with chronic conditions like diabetes, for example, and those employees who have to go to the doctor more, I think that's definitely, you want to have that care and support from employers for sure. So And I know you both had mentioned diabetes, of course, but I want to go a little bit more into diabetes management in particular. Endocrinology is among the top ranking specialties taking advantage of phone or virtual visits. So why, again, does remote care for diabetes management in particular make so much sense?
Yeah, the answer is really twofold. It's the convenience that we talked about for people living with diabetes, but that also applies for the providers as well. And the video and phone visits between healthcare providers and patients, they're so easy to arrange and easy to get used to, right? Molly, what else would you offer there?
Yeah, I totally agree with that. And then collecting and sharing data like blood glucose, insulin dosing from personal devices like blood glucose monitors, that doesn't need to be done in person, and it streamlines the process, and it streamlines conversations and allows for shared decision making. So this telemedicine has really been shown to achieve therapeutic results that are absolutely equal to, or even in some cases superior to, in-person visits for people with diabetes, but even other chronic diseases. And it likely is because there is elimination of those barriers to get to the physician and to actually keep those appointments up.
Great, absolutely. And can you give me a little insight too, as far as, what diabetes care looks like? So, how often does a person who is diabetic, how often do they usually visit the doctor? And how do they manage their condition in between visits?
So generally, it's recommended that people with diabetes check in with their doctor, whether that's a primary care doctor or a specialty like endocrinologists, every 3 to 6 months, depending on where they are in their treatment plan and their goals. But regular visits, whether they're in person or remote, allow the healthcare provider to continue to track all of the health data like blood sugar, blood pressure, and make adjustments to the treatment plan as needed instead of waiting longer. And new technology platforms like the one from Roche Diabetes Care platform make that even easier to track data, share data, and spot patterns and trends. Scott, is there anything you'd like to add?
Yeah, I think that when it comes to between visits, right? Um, if you think about the time spent at the doctor's office or with an expert, there's a lot of time in between those visits where someone with diabetes has to make a lot of decisions and needs more support. And that's where diabetes coaches and educators are there to answer questions, provide some more personalized support, and can even clarify information that they're getting from the doctor or that doctor interaction. So if there's confusing questions or confusing instruction, then I feel like I can reach out to my coach to clarify that, or maybe even offer some guidance on what follow-up questions I need to ask. So there's so much help that I can get between those visits there with someone that's available through a remote coaching offering.
That seems really important. And on that note, how can an educator or a coach, how can they help translate goals from the doctor? For example, to lower your A1C, for example, into these realistic action plans.
Yeah, absolutely. That's a great question, Kathryn. So the some of the great examples, like we just mentioned. So educators really help people living with diabetes prioritize. So as we just mentioned, sometimes people might leave their doctor's appointment feeling overwhelmed, not sure how to achieve some of the goals that they talked about with their care provider. So educators can help break that goal down into a series of steps that need to be achieved. One great approach that's often used is something that's called SMART goals, and that stands for specific, measurable, achievable, realistic and time-based. So it's a framework that helps set these goals up in a way that it's been studied and shown that this is a great way to work on goals together. And that's just a couple of ways that coaches can help. Molly, I want to throw it over to you for some more insight on that too.
Yeah, thank you. And great job with the SMART goals. That's super important. And I really believe that the diabetes educator is one of the most crucial pieces of the diabetes care team, because they have all these skills and they're very, very well trained. Educators also can help, because I think that it's important that goals are not set by the doctor or the educator. They're set by the person with diabetes, or at least in conjunction. And educators are really good at being able to have those motivational interviewing questions and really build a rapport with the user. With the patient, with the person with diabetes. And we also are able to advise on how to check blood sugar, when to check blood sugar, and how to adjust or pivot your goal if needed. Again, because the person with diabetes is hopefully setting the goal, and if it might be too far stretched, they may find that out on their own in a few weeks, and then the educator can really work well with them to help pivot to meet what their real goal is. And again, diabetes educators, at least certified diabetes care and education specialists, are highly trained. And I won't go into all of the details, but you have to have a clinical background, and you have to have a certain number of practice hours and pass an exam and continue education. And ours at My Sugar, we contributed to a program that is now recognized by the American Association of Diabetes Educators and URAC, which is a telemedicine certification. And it's one of the leading independent accrediting organizations for supporting quality in diabetes education programs and healthcare in general.
And there's another way that really has helped me in my personal life with diabetes, and that is if I take one of these goals that I'm working on and I bump into some challenges, or I'm having trouble with it, I can talk with my coach about ways to try and overcome these challenges. So let's take an example of trying to make improvements in my nutrition, right? And I often overestimate the amount of change I can make, right? So I might come out of an appointment and my motivation is super high, I'm raring to go, and then I get into my real life, I try and make all these changes, and it might work for a little while, but then life happens and I can't keep that level, I can't sustain that level of energy. And so I can have a conversation with my coach about, all right, look, here's where I'm at. What are some smaller changes that I can incorporate into my everyday habits that are going to provide me some bang for the buck, right? Like, what are some of these changes that I can make? Let's take a real world example. So I enjoy rice, but rice has a lot of carbohydrates. Carbohydrates can be challenging to manage with diabetes. There is a thing called cauliflower rice, but it's not the same. It's cauliflower, right? But on the suggestion of a coach, the idea of maybe mixing half and half, right? So I'm getting a little bit of the rice I enjoy, but I'm also reducing the amount of carbohydrates. I'm making my diabetes management for that meal a little bit easier to manage. And that's a small change that has big impacts in my overall diabetes management. And so there are these little ideas that when a person has quality time that they can work together with a well-trained expert in diabetes, they can come up with ways that fit together in their life that make a big difference.
I love that example. It's nice to see those kind of tangible things, especially when you are managing something that's chronic. And I'm sure you have so many things that you're trying to think of, and you have all these, appointments and everything else to manage. So you don't always want to do everything on your own. It's nice to have someone who can help you with some of those things. I like hearing that. And then, what about when you have these appointments, which I'm sure people who are diabetic who have more appointments than, someone who doesn't, obviously, how can an educator or coach help someone prepare for those upcoming doctor appointments? Can they help?
They absolutely can help. And I think this is a place where a diabetes educator plays an extremely important role, because we, again, are the experts in diabetes, but we also have this more relationship rapport building skill and more time that the doctors just don't have. So we're able to review any confusion, any areas of confusion in the person with diabetes, whether that was their last appointment or their upcoming appointment, of, what is an A1C? What is that? What my doctor keeps telling me this is important, but what is it? And what do my blood sugars mean? So even starting with the basics, but also asking any questions that might prompt them to think of what's important for them to get out of the appointment. I think that squeezing out the most you can out of a 10 or 15-minute appointment with the physician is so important. And the diabetes educator can help the person with diabetes prioritize their concerns and get the most answers that they need, and then also talk about what can wait to another appointment for a follow-up, or be addressed directly by the diabetes educator. And typically we recommend that you come in with a list, like just create a couple bullet points for what you need done. What prescription do you need refilled? What side effects are you having to other prescriptions that your doctor might need to address? Because oftentimes when you're sitting in front of the physician, I mean, even I have this when I go see my diabetes specialist doctor, I forget that I wanted to talk about something. So I always make myself a list. But when you have such a short amount of time, it's really crucial that you get, like Scott was saying, a big bang for your buck in every single way that you can. But it can also help. Diabetes educators can almost be like translators from super medical clinical language to more digestible terms, and really help as well. That piece helps with the, I think, emotional, feeling more comfortable with in the appointment with the doctor, or just in general dealing with their diabetes. But we're also here as their coach. That's why I love the word coach that's at My Sugar, because we really are wanting to give this feeling like we're on your side here. We have a relationship. I have this certain knowledge, but I don't know everything. You know your diabetes best. So I'm here to support you in getting the most that you can out of your care, because diabetes too is only one piece of someone's life. And to be supportive, to get them to the care level that they want, so that they don't have to think about it anymore, if it's not a huge burden. That's where I think that we can really help and prepare them for their appointment with their doctor.
Another way that has helped me is going into my doctor's appointment knowing what areas of my diabetes data management I want to focus in on a little bit more. So, for example, with dealing with diabetes, I generate a lot of blood sugar records, and the best use of my time with my diabetes specialist is kind of zooming in on that data to talk about what can I do about those areas that I'm struggling with. But at the same time, as Molly mentioned, I have a lot going on in my life. Diabetes is just one part of it. So I often feel overwhelmed when I try and interpret my own diabetes data. But the fact that I can ask my coach for help in highlighting patterns and trends, and that's what is a really key thing to look for in that diabetes data. And then I can present these patterns and trends to look at together with the doctor and get an expert opinion on some things I can try. And then, like we talked about just a few minutes ago, I can work with my coach on those suggestions and how to best implement them in ways that fit in with my life really well. So it's really a beautiful example of teamwork all the way around, from the person living with diabetes to the coach that can help from, between those doctor's appointments to those bits of time throughout the year with the actual clinician in the office.
Absolutely. That sounds so beneficial it sounds like everyone should have have a coach and educator just for every medical thing that they deal with. Like you said, especially for interpreting stuff like blood tests or, whatever kind of diagnosis maybe that they throw out, and trying to figure that out. So it definitely sounds great. And, we're in this interesting time, obviously, with the pandemic. And now with the rollout of the vaccines, things are starting to, open up a little bit more. And we're going to see more of that as far as restaurants and stores and offices. And with that, we're going to see habits and daily routines surely begin to change. And that certainly includes a shift in the way people have been managing probably their chronic conditions. So how would you advise people with diabetes and maybe associated chronic conditions like obesity or hypertension to stay on top of their care?
Yeah, that's a great question. And I'm very excited that we're approaching a sense of normalcy. It's been a long road, hasn't it? But I think, especially around diabetes, we'd give the same recommendations as we would under any other circumstances. And that is, really to make a commitment to managing your diabetes, following a healthy diet, staying as active as possible, and following recommendations to check your blood sugar levels. Do what you can to keep your weight, blood pressure, and cholesterol numbers in target ranges. Don't smoke. And another key thing, especially as we transition from, I don't know about everyone watching, I have been a serious homebody over the past year, but as I get back out and into the world, I am going to pay special attention to how my feet cope with that additional activity. About 50% of people with diabetes also deal with something called diabetic neuropathy, which can affect feeling in the feet and make it more difficult to feel any injuries or things that we need to address with our feet. So I'm going to pay more attention and watch for problems with my feet as I start to use them more often.
Definitely, it'll be interesting to see kind of how things shake out. Certainly, when things, get more normal, for people with conditions like that, and just for all of us in general as well. That's for sure. And then, going back to the pandemic, what is the best way to support employees with diabetes and associated chronic conditions, during a pandemic, which is just throwing everything off, of course, and then, of course, ongoing into the new normal, which we just were talking about?
Yeah, absolutely. I'd say there are a few great ways that employers can support their employees with diabetes. And the first one is to recognize that diabetes is personal, and everyone's needs are a little bit different. In a survey that we conducted of employees with diabetes, again, 81% say that their own diabetes management needs are unique. And 9 out of 10 believe that one type of diabetes support program doesn't fit all needs. Molly, what other thoughts do you have there?
Well, I feel very strongly about providing a safe environment, essentially an emotionally safe place, which means normalizing blood sugar checking in the workplace, or being able to take time away for a physician appointment without penalization. And then, of course, being able to provide a personalized digital coaching diabetes program. And this can simplify disease management at home and at work. And Roche Diabetes Health Connection provides this kind of support as well as all the supplies. And to mention that survey again, 92% of those surveyed said that they would definitely like to use this program, and they'd be engaged with their own management a little bit more.
Yeah, and the last thing I would add to that maybe is just communicate, right? So all employees, and especially those with diabetes, want to feel safe and heard at all times, like you mentioned, Molly. And and listening is also important. Employees should feel that they can freely and confidently share concerns. Everyone benefits from feeling a part of a community uh, during the uncertainty of the pandemic, for sure, but especially after we move into a new normal and have to start figuring out how this new normal works again.
Great. And I'm going to ask one more question. We're just at about time just to wrap things up. I'm just curious, why should you have so much great insight that you guys have shared? Why should employers step in to help with this? Why should they help employees with diabetes, which, does affect a big chunk of the population? I'm sure that probably is part of your answer. But, diabetes and other, of course, chronic conditions as well.
Yeah, you're right, Kathryn. That is definitely part of the answer, is that it affects everyone. Whether, with the prevalence of diabetes in the world, someone living with diabetes, whether they're comfortable sharing that with you or not. And everyone I know with diabetes wants to be the best person that they can be. They want to be the best employee that they can be. And it's bothersome when diabetes affects their performance in the workplace. It is irritating from someone personally who has to maybe pause a meeting, or if I'm dealing with a low blood sugar, my performance in the workplace is affected, and I don't want that to be the case. I want to be the best employee that I can be, and people deserve all the support that they can get. Managing diabetes is challenging, but definitely possible when all the right pieces are in place.
Excellent. And we're at time. So just a big thank you to our experts, Molly and Scott. Thank you so much for the time and the insights. And of course, to Roche and to MySugar as well. This has really been insightful and interesting. And just a final note, if you'd like to learn more about the MySugar program brought to you by Roche, go to Roche Diabetes HealthConnection.com. And of course, thank you to all of you for joining us and tuning in today. We hope you stay safe, and we will see you next time.
Hi, thank you.
Bye, guys.